How many, if you maybe have an idea, I don't know if it's a difficult thing to record, people come to your hospital with illegal abortions?
Very difficult to know. Very difficult to know whether this is legal or illegal, because what they actually do now is to go to they go to certain doctors that are not entitled to do TOPs, and they get tablets from there, and then they just do it. And then when they are bleeding, they are sent to us. So when they are bleeding, really, what we are interested in is to stabilize them and organize everything.
Do you see a lot of maternal deaths from illegal abortion?
We still see maternal deaths from illegal abortion.
Is there, just if you can maybe explain the mechanism to me, it's the illegal abortion doctors. Do they get hold of these pills that induces labor?
They get hold of the pills, how we don't know. And some of them are not even doctors. Not even doctors, bogus doctors. They've got a corner there. They charge patients money, and then that's what they do.
Is this the majority of illegal abortions that you see, or are they these chemical abortions? You don't see the manual ones so much?
No, the manuals are not on the rise. The commonest one is the tablets one. Misoprostol.
Do your department deal with emergency contraceptives, or?
We deal with it.
Oh, you do? Okay.
We do almost everything.
Okay, so you also...
If some people have been traumatized, raped or whatever, we do afford them an opportunity to get emergency contraceptives.
Do you have problems with doctors and nurses who don't want to work in the TOP clinic?
Definitely.
You do?
We have people for religious reasons who would not be willing. They would know the ones that are there now, they work willingly.
Okay.
But fortunately for us as doctors, if somebody comes in here bleeding, our priority is to stabilize the patient, save the life. So we will do whatever. We don't have the right to say no, we don't want to do this.
Okay,
you understand?
If they come from
it's only when somebody comes in requesting a termination of pregnancy to you, and you are uncomfortable with that, then we'll refer them to the clinic or to the next colleague who does it. But if they come in, we as an emergency, they are bleeding, that we don't differentiate whether it's illegal or legal. You have to attend to the patient. Remember, termination of pregnancy is something that is still frowned upon in our community. People look at you as a killer, whatever, all those things. Even if you are, there are people who feel that even if you are, for instance, sexually assaulted and you fall pregnant, you don't have the right to terminate that baby. You know all that. Now, that's number one. Number two, some people fall pregnant while having other relationships, and they wouldn't like to be seen. And some people have got relatives here. They don't want relatives to know that they've actually terminated a pregnancy. So it's all that stigma associated with that. And religiously, a lot of people, they still feel that nobody has got the right to take life, and termination of pregnancy, it's something that we shouldn't allow. So I feel that there should be an inline ward where we could give this lady tablets. They lie here, and then they abort here. We dispose of the tissue nicely, and then we clean them, and then they go home. That's my feeling, and I've been fighting for that, but unfortunately staffing is a problem. Accommodation or what is a problem. The biggest challenge is staffing. If I could have a doctor, for instance, I don't have a doctor dedicated to that service.
The second premise then?
I don't have. It's only Dr. Bekovitz, and he does it alone. He's got other duties to do. He's a consultant. And we only take them to theatre for cleaning. But if I had a doctor dedicated to assessing these patients, counseling them and looking after them, prescribing treatment for them, then things would have been much, much better for me. I would really say our service is at the level where I want it to be. To say, look, this is what we should do. Because I even though I'm a Christian, even though I don't do TOPs, I think I've got a responsibility as the head of department to see to it that things are run smooth, and to see to it that women are not abused emotionally or otherwise, and to see to it that women get their abortion in a safe environment. It's not about me, it's about them. It's not my beliefs, it's about securing that women do not die And this is one of the things that I feel, even though I don't do the service and like I'm not actively participating in it, but I feel if we could do this, it would save a lot of women's stigma, it would save us a lot of maternal death, and men would be treated with dignity. Because currently there's no dignity at all.
Yeah.
Most of them are in the second trimester, the majority, they're coming late. They're coming late. Hence they do not qualify. For instance, there were the ones that were not recommended, 19 pregnancies in January. Those patients, they couldn't be terminated because they were late. And in February, 16.
Wow,
that's about 35 in 2 months. And those 35 people will go to backyard abortions if they are quite desperate. And what happens then? They come back here septic, complicated. There are other maternal deaths, and they go to ICU, and we know the amount of money involved in caring just for one patient in ICU. We've just had, you see now, I'm giving you some of the things. We've just had a patient from Middleburg, that was on Monday. Middleburg, who came in after an abortion. We don't know whether it was backyard or whatever, backstreet abortion, we don't know. But she came in, and from the history, when they were trying to clean her there, they drained her 5 liters of pus from the womb. So she was clearly septic when she left there. When she came here, her blood could not clot. She was in what we call the IC. She was just septic. 17-year-old, and she died in ICU.
Oh my God.
We did a hysterectomy on her, same evening. We put her on adrenaline to support the heart because the heart was failing all the organs in her body. 17-year-old, hysterectomy on adrenaline, and she died. When she arrived in Livingston, we don't have an ICU here, but we are a mother and child unit here. Died at Livingston, 17.